Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious diseases, hepatology, and gastroenterology. Our topic today about gastritis. So, what is gastritis? Gastritis is an inflammation of the protective lining of the stomach. Acute gastritis involves sudden severe inflammation. Chronic gastritis involves long-term inflammation that can last for years if it is left untreated. Erosive gastritis is a less common form of the condition. It typically does not cause much inflammation, but it can lead to bleeding and ulcers in the lining of the stomach. So, today we will discuss symptoms of gastritis. Gastritis does not cause noticeable symptoms in everyone. The most common symptoms are nausea, vomiting, feeling of fullness in your abdomen, particularly after eating, or indigestion also. If you have erosive gastritis, you might experience different symptoms, including black tar stools or vomiting blood or material that looks like coffee grounds. Treatment it differs from person to person. The treatment of gastritis depends on the cause of the condition. If you have gastritis caused by non-steroidal anti-inflammatory drugs or other medications, avoiding those drugs may be enough to relieve your symptoms. If you think your prescription medication is causing gastritis, talk with your doctors before stopping or modifying the dose. Doctors routinely treat gastritis as a result of Helicobacter pylori with antibiotics in order to kill the bacteria. In addition to antibiotics, several other types of medications are used to treat gastritis. Proton pump inhibitor, very useful in treating gastritis, like omeprazole, lansoprazole, esomeprazole. However, long-term use of these medications, especially at high doses, can lead to increased risk of spine, hip, and wrist fractures. It can also lead to increased risk of renal failure, dementia, and nutrient deficiency. So, we have to avoid long-term treatment of these medications, and also to consult the doctor as regard the period of use. Also, we can use acid-reducing medications like Famotidine. Famotidine is one example of medication that reduces the amount of acid in the stomach. By lowering the amount of acid that is released into your digestive tract, these medications relieve the pain of gastritis and allow your stomach lining to heal. Also, antacid. As regard antacid that you use rapid relief of gastritis pain, these medications can neutralize the acid in your stomach. Some antacid may cause diarrhea or constipation. Also, probiotics. Probiotics have been shown to help replenish digestive flora and heal gastric ulcers. However, there is no evidence that they have any impact on acid secretion. There are currently no guidelines supporting the use of probiotics in the ulcer management. So, what are the causes of gastritis? Weakness in your stomach lining allows digestive juices to damage and inflame it, causing gastritis. Having a thin or damaged stomach lining raises your risk of gastritis. A gastrointestinal bacteria infection can also cause gastritis. The most common bacteria infection that causes it is Helicobacter pylori. It is a bacterium that infects the lining of stomach. The infection is usually passed from person to person, but can also be transmitted through contaminated food or water. Certain conditions and activities may increase the risk for developing gastritis, like extreme alcohol consumption or routine use of non-steroidal anti-inflammatory drugs like ibuprofen and aspirin, also cocaine use, also old age because the stomach lining thins naturally with age, also tobacco use. All these factors may lead to gastritis. Also, less common causes like stress, autoimmune disorders, also digestive disorders like Crohn's disease, viral infection. All this may lead to gastritis. So, what about diagnosis? As regards the diagnosis, this is through medical history and from symptoms and from family history. They may also recommend a breath test or stool test to check Helicobacter pylori. Also, sometimes perform an upper gastrointestinal endoscopy or perform an upper gastrointestinal series involving X-rays or swallow barium solution. This will help distinguish areas of inflammation. Also, sometimes blood tests to check other causes of gastritis or symptoms or complications of gastritis. Also, sometimes stool sample to check Helicobacter pylori infection. Also, urea breath test to check Helicobacter pylori bacteria. As regards the latest and alternative medicine, as regards this, this get innovative health and wellness tips to treat this Helicobacter pylori or gastritis. As regards the complication, if your gastritis not treated, it can lead to variety of complications. Certain forms of gastritis can increase your risk of developing stomach cancer, particularly in people with thin stomach lining. Complications like anemia, deficiency of vitamins like vitamin B12 or vitamin D or folic, and also vitamin C or zinc, calcium, and magnesium also. A bleeding in the stomach, perforation inside the stomach, peptic ulcer, chronic atrophic gastritis, gastric metaplasia and dysplasia. This is precancerous lesion in the stomach. Achlorohydria, which prevents the stomach from producing the acid, and it needs to digest food properly. Perforation of the stomach, cancer like adenocarcinoma. All these complications of gastritis. As regards the prevention, so it depends on your health and whether or not you have any conditions that put you at risk of developing gastritis. But since gastritis does not always have a clear cause, so you have maintaining good hygiene habits, taking good care of your mental health, eating smaller meals more slowly and regularly, stop smoking, avoid or limiting alcohol and caffeine, avoiding takeaway foods. All this may lead to diminish the risk of gastritis or its complications. Thank you very much.